Thank you very much, ladies and gentlemen. Thank you for taking time out of your busy schedules to be here today. I would be remiss if I didn't also thank the Minneola city officials for their hospitality in allowing us to use this room. And I specifically wanted to thank Mayor David Yurty and City Manager Sam Okelier. And certainly those loyal public servants who work for the city of Minneola, who probably have been inundated with "how do I get there from here" kind of remarks. I also realize that we have an overflow crowd and that some folks are in the gym, and I wanted to recognize them. So for you folks who are in here, there's an equal number or greater also in the gym where there's a remote broadcast of the events today. Just wanted to let you know that I think this is a very important issue, and obviously you do too. A few housekeeping items before we get started. As you walked in, you received a card, and there's room on there for a question. And if you fill that out, we'll attempt to get to your questions. And staff will be coming through the aisles periodically to get additional questions from the individuals, including those who are in the gym. I'll respond to the questions at random, both those who are for the program and those who are not for the program, and I'll do my very best to get through all of the questions. If I don't address your question today, we'll send you a response via the mail. So please be sure you include your name and contact information, because we can't respond to you if we don't have that information. I am joined today by a panel of professionals from the healthcare industry. We have Dr. Deborah Tracy, and Dr. Tracy is a board-certified anesthesiologist. Remember, they're the ones who put you to sleep. Among her many credentials, she's been involved in the evolution of Medicare's local coverage determinations for physicians here in Florida, and is president-elect for the Florida Society of Interventional Pain Physicians. We also have Pete Clark, who is the, Dr. Tracy, if you would stand so they know who it is. We have 2 females and 2 males. And Pete Clark, he served as president of Florida Public Health Association, and among his many awards, he received the Community Partner of the Year Award from the Florida Association of Health Centers. Pete, please stand up. Leslie Longacre is a familiar face here in Lake County. She is currently the CEO of the South Lake Hospital. She's a nurse by profession, and she served as chair of Cornerstone Hospice, South Lake Chamber of Commerce, where I first met her, and United Way of Lake and Sumter counties. Leslie, please stand up. And, last but not least, we have Dr. Miguel Fana, Jr., who is board certified in internal medicine and with a strong focus on geriatrics. Dr. Fana was recently awarded Teaching Attending of the Year for the Family Practice Residency Program at St. Petersburg General Hospital, where he is also chairman of the Continuing Medical Education Department. Dr. Fana? You know, I just came from an editorial board meeting, and I told them that I think everybody agrees that changes do need to be made to our healthcare system. But I think instead of reinventing the wheel, we should focus on the parts of our system which actually need fixing. Yeah. From the very beginning, I have said that I think that we need to fix Medicare first. Currently, more than 45 million people receive their health care through Medicare. And remember, every single day, 6,000 baby boomers are signing up for Medicare. And so the trust funds are obviously in very serious financial jeopardy. The trust fund will be bankrupt actually in 2017, just 8 short years from now. Congress really needs to fix Medicare before providing some additional entitlements, but we do need to work on a health care solution for those not on Medicare. Medicare's negative reimbursement rates make your private insurance actually cost more. We shouldn't be cutting from the Medicare programs. I think I'm supposed to press this here. No cuts, okay? No cuts to the Medicare program should take place. The plan that's before Congress right now, 3,200, actually cuts Medicare. Let me see if I can do this right now. Actually I can't do it and talk to, so I'll help you, Dr. Tracy. Actually cuts Medicare by $538 billion. And it makes cuts in areas such as Medicare Advantage and therapies and nursing home reimbursement. Seniors should not be asked to sacrifice the quality of their health care, and I don't think that my constituents want me to support a plan that cuts Medicare, slide 2. The other thing is, and this was another thing that I said to the Orlando Sentinel, is we need to protect the doctor-patient relationship. Yes. I don't want bureaucrats empowered with a vital decision about your medical care. HR 3200 actually allows an unelected board and their members to decide what acceptable health care coverage is and what treatments should be to patients. These are decisions that rightfully belong to the patient and their physician, not to government bureaucrats.